Dear colleagues, friends, thanks for joining us for today's webinar that is organized by Danila Halitsky, Lviv National Medical University and Ukrainian Council of Science Editors. And it's going to be international event because we have participants from different countries from Ukraine, Kazakhstan, Croatia, Bulgaria, Turkey, Poland, and also US, UK. And today's webinar is an opportunity for PhD candidates and their research managers to learn more about principles of quality open access, reliable and evidence-based searches, and correct statistical data presentation. And it's a big pleasure and honor to introduce our today's speaker, Dr. Armen Gasparian, who is a regular contributor to our webinars. He is a highly skilled journal editor, author, more than 100 articles published in English medical indexed journals. And he is also expert reviewer of Scopus database. Dr. Armen, please.
Okay. So, Dr. Olena Zimba, thank you very much for a kind introduction. It's a great pleasure and privilege to lecture for our audience today. It's an international audience, a lot of participants from Kazakhstan, some participants from Turkey, friends from Poland, Bulgaria, Croatia, and also Ukraine and Russia. So thank you to all our participants for their respect and support of our European initiative. We are going to discuss topics of interest to PhD candidates, those who are doing research in global health, public health, but also in allied health disciplines, in clinical medicine. All today's points will be of a great importance for research managers as well. So without lengthy introduction, I am going to start my first presentation. So let me share screen with our participants.
Yes, you can do this. And also we encourage our participants to ask questions. You can simply type them into the chat box on your Zoom panel, and we will have time after every presentation to discuss your questions, or you can ask these questions directly after presentation. Okay. Yes, everything is fine. We can see your screen with your presentation.
Okay, Olena, just from time to time, remind me that everything is okay, no interruption. So, and all
no interruption, everything is okay. Yes.
Yeah, throughout the webinar. Okay, so today we are going to discuss evidence-based pyramid. This pyramid is not just for global health or public health, but it's also for medicine in general. And these evidence-based principles were introduced in late 1980s, early 1990s by experts in biostatistics, by experts in public health. Global health is something different, and it's a discipline, emerging discipline, something new for some of our clinicians, but public health specialists are well aware of global health as it was initially termed world health. So to start discussing scientific points, we should go to National Library of Medicine medical subject headings vocabulary and find out definitions of our keywords that we are going to use for today's presentation. And the same principle is applicable to all our presentations, to all scientific topics. Without knowing keywords in a particular field of science, we cannot discuss any issue in detail. So evidence-based medicine is a keyword initially introduced in 1997. So with slight delay, because it takes time, it takes years to introduce a professional keyword to National Library of Medicine vocabulary, MeSH vocabulary. So, and it's now well known that evidence-based medicine has primary interest in quality of patient care. So all our research activities, all our secondary research activities, such as systematic reviews and narrative reviews, are aimed to generate evidence, to generate practice recommendations or practice guidelines, which can be used to improve patient care. And of course, evidence-based medicine is concerned with best available research data. Evidence-based nursing is slightly different, and it's a relatively new term, because in most developed countries, nursing is an advanced field of science and clinical medicine, and nurses also practice in line with best available research and best research data in their own field in nursing. So probably our participants from Central Asia know that in Kazakhstan, let's say, nursing is one of the priority fields of medicine and science compared to other Central Asian countries, where, let's say, in Turkmenistan, nursing is abolished as a specialty at all. There are no nurses. There are just doctors, physicians, and no nurses. But it's just extreme. We also know that global health, it's also relatively new discipline. Initially, specialists were working, or public health specialists were working in world's health. It was just a term, world health. But over time, particularly because of accumulated research in public health, because of diversified research, and a number of well-organized population-based epidemiology studies, the term global health was introduced, and proponents, supporters of this term were editors of Lancet, like Richard Horton, chief editor-in-chief of the main Lancet, the Lancet. So global health is considered as an interdisciplinary field of science concerned again with patient care, with improving health services to patients. And of course, global health is based on a number of policy statements, declarations, particularly Almaty Declaration, Astana Declarations. Public health specialists know that basic principles of public health, primary health care, are presented in seminal declarations, in declarations such as Almaty Declaration and Astana Declaration. And of course, currently global health is considered not just responsibility of health specialists, but also other society members, society representatives are also involved in improving global health in improving patient care. Particularly, we know that social workers, nurses, psychologists also care a lot about healthy subjects' well-being and patients' health promotion. So we also know that Scopus, as the largest bibliographic database, contains numerous documents on global health, and you can see that currently the number is fast approaching 60,000 articles tagged with global health. Most of these global health articles are from United States, United Kingdom, Canada, Australia, and China. So big five countries concerned with global health are those where public health facilities are well developed, and their main concern is to improve patient care using best available research data. And today we are also going to discuss how to find best research data. Of course, we can use Scopus as the largest bibliographic database, and we can also distinguish top evidence-based data or highly cited research data. To some extent, citations also may point to the level of evidence. So this is why we may use Scopus, we may rank articles in certain fields, particularly in global health. We rank in line with their citations. We may also use altmetric information and may also distinguish highly cited and well-commented articles, well discussed on social media articles, as those with high level of evidence. So we should also pay attention to journals frequently covering global health issues. Of course, Lancet and Lancet Global Health are the leading journals or the leading platforms for evidence-based in global health. Any research fellow working on PhD in global health should include reviews, practice recommendations, large cohort studies, or epidemiological studies published by Lancet Global Health in their research studies, in their research articles. Yeah. Guys, please switch off your mics. You can join us without making noise, please. So, and you should also know that one of the leading journal representing World Health Organization, Bulletin of World Health Organization, is also the leading platform of research or of evidence in global health. When it comes to Ukraine, some other European countries, Central Asian countries, the number of articles tagged with global health is much lower compared to other countries, but it's because this field of science is just taking first steps in Eastern Europe and Central Asia. Yeah, and one more important point. There are some leading scientists who publish abundantly in the field of global health. Richard Horton, chief editor of The Lancet, is the leading author in this field, and he frequently discusses public health and related issues, and he also was in favor of launching Lancet Global Health Journal about 10 years ago. There are also some other scientists. I should remind our participants that public health specialists are quite active in research, and their citation metrics are quite high. Like, let's say, Hirsch index of public health specialists is relatively high, though these scientists are not active on social media. It's paradoxical, based on altmetric attention score of public health articles. But there are some scientists like Richard Horton and Mohsen Naghavi. You can see these scientists with astronomically high Hirsch indexes. Like Mohsen Naghavi, he is a data scientist from US. His Hirsch index is 94. For in the field of public health, it's a remarkable achievement. And he is one of the top scientists who publishes a lot of global health reports, epidemiological data, and most of our participants know that global health reports published by Lancet or Lancet series journals are well cited. And each of these articles are authored by hundreds or even thousands of authors. So this is why H indexes of co-authors in these articles, global health reports articles, is quite high. But Richard Horton, chief editor, he publishes news items, editorials in Lancet journal, the Lancet journal, and this is why his publication level, publication activity is quite high. So I see that our participants from Kazakhstan is joining and reminding us about their presence. Thank you, guys. So we know that evidence-based pyramid contains of several sections. The top section includes clinical trial reports, systematic reviews, then large cohort studies, case series and individual case reports, and at the bottom of pyramid we have expert opinion or individual scientific facts. So it's an established evidence-based pyramid. However, the current concept of revising evidence-based pyramid suggests that we should pay attention to quality of these evidence-based articles. Not all clinical trial reports are up to high standards. Let's say in some clinical trials, sample sizes are low, let's say 10, 20, even though these clinical trial reports are well designed, but their influence is not high. Their citations are not high. And this is why we may use other evidence-based articles, let's say large case series. And we may also slightly move these articles closer to the top of evidence-based pyramid. The concept turned to be important, particularly in the era of COVID-19 pandemic, when at the initial stage of the pandemic, when we as clinicians or researchers were considering large case series or case control studies as evidence-based articles. So currently we consider different types of articles as evidence-based research articles, even case series, if these articles suggest something useful for clinical practice, for patient care. If there are no large clinical trials, we may rely on large case series or even expert opinion pieces, well cited, well promoted on social media. And again, in the era of digitization, in the era of COVID-19, social media plays an important role, and we should pay attention to social media metrics such as altmetric attention score. And the higher that score, the level of influence of articles is also higher. So we may rely on this principle when there is lack of well-organized or large clinical trials or processed systematic reviews with meta-analysis. Not all systematic reviews and meta-analysis, particularly those coming from China, are up to high standard. This is why there is no need to include systematic reviews in certain fields. In the evidence-based pyramid at the top, we may move systematic reviews slightly lower and consider large case series, large cohort studies at the top of evidence-based pyramid. So evidence-based pyramid, the concept is being revised. So, and you as clinicians may also find useful to look at altmetric.com reports, individual article level metrics, social media metrics, and citation metrics. So this information is useful to distinguish influential articles, those with a lot of citations, a lot of social media comments. In practice, most citations, most social media comments are positive, discussing positive or helpful comment or helpful points for clinical practice. So clinicians also need information about social media metrics. The same with public health and global health specialists. Knowing how these metrics are generated will help them to use this information in their research. Those who are writing systematic reviews may also consider quality of primary research studies, relying on grade recommendations. So, grade, pro or grade recommendations, grading recommendations, assessment, development, and evaluation grade system consider high quality research studies when further research is very unlikely to change our confidence in the estimate of effect. And at the same time, very low quality research studies when any estimate of effect is very uncertain, uncertain. So clinical trials also can be of low quality or with a lot of limitations. And in that case, we may degrade these clinical trial reports or primary research studies and exclude these primary research studies from systematic reviews. So we, for writing systematic reviews, even for narrative reviews, may also use the same principle. We need high quality research studies, and we may preferentially exclude poor quality clinical trials, cohort studies with a lot, or case control studies with a lot of limitations. So great system of qualitative assessment of primary research studies is important, and it's also used, this principle is used by those who are writing primarily those who are writing systematic reviews. And great database can be also used by those who are writing systematic reviews. Systematic reviews and narrative reviews benefit a lot from PICO tool. It's a tool used by all specialists, primarily by clinical practice specialists, clinicians. So those who are working with primary research studies, they consider patients, you can see, or problem or population. What type of patients should be included? So how these patients are treated, intervention, whether there are any comparators or in case control studies, let's say, or placebo or other drugs, let's say. And of course, the last component of PICO is outcome. When we consider hard events, like vascular events, like myocardial infarction or death, mortality. So PICO tool can be also accompanied by S component. It's called PICOS, when systematic review or narrative review authors process articles, homogeneous articles with a specific study design. Let's say only cohort studies, when there are no clinical trials, authors may process large cohort studies. So PICO's tool can be also used by those who are writing systematic reviews based just on case series. Again, last component of this tool is study design, case series. But of course, systematic reviews are usually written based on clinical trial reports, several trial reports, not just one. Sometimes I process systematic reviews where at the end of processing data, primary data, authors end up with just one clinical trial. That's not systematic review, just a single scientific fact or just a short communication, but not systematic review. In systematic reviews, authors deal with a handful of research studies, either trial reports or clinical cohort studies or case series. Now, on top of our evidence-based pyramid, we usually have practice guidelines. Practice guidelines are, again, we deal with two keywords: publication type and practice guidelines as topic. So when we search for practice guidelines on PubMed, in PubMed platform, we use first keyword, and then the second keyword is specific professional keyword, let's say rheumatoid arthritis or global health or Kazakhstan geographic terms are also used. So practice guidelines are those based on clinical trial reports, systematic reviews, and all other types of articles. And again, in practice guidelines, authors grade evidence of each article processed for writing practice guideline. So we know about European rheumatology guidelines, American rheumatology guidelines, ACR, EULAR guidelines, guidelines for public health, specialists for health promotion, generated by health promotion associations, large associations. So in the era of COVID-19, particularly at the initial stage, practice guidelines were written based on expert opinion. So these were emergency practice guidelines. Quality of evidence in these practice guidelines were not high. However, the importance of these practice guidelines was huge. And these practice guidelines were also well cited and well commented on social media. So we, at least for the time being, can use practice guidelines, emergency practice guidelines at the top of evidence-based pyramid. So now you understand that we deal with flexible concept of evidence-based medicine. And if there are no clinical trial reports on COVID-19, we still may benefit from large case series or even individual case reports. Nowadays, we have a lot of case series about vaccination side effects or adverse effects of different vaccines, COVID-19 vaccines. And each of these case reports is published in view of previous publications. Any case report on adverse effects of these vaccines is valuable evidence, even though these case reports could be traditionally considered at the bottom of evidence-based pyramid. So nowadays, we should be more flexible and we should pay attention to the importance of articles, to the level of citations, positive comments, positive feedback on social media. Practice guidelines, those published by well-established organizations, can be used in our clinical practice. You also know that in the era of COVID-19, for patient care, we rely on practice guidelines publicized by NICE, by SIGN, American Family Physicians Association, so large or well-established UK or American associations. Unfortunately, there are no well-publicized guidelines from Eastern Europe or Central Asia. All local guidelines are developed in line with WHO recommendations or with well-established institutions, practice guidelines institutions, with adaptations to local conditions. However, some of these guidelines still can be considered as living standards of care. Living means they still await for quality evidence to improve level of evidence of these guidelines and enforce these guidelines in local practice. So practice guidelines should be also considered very carefully, and skilled specialists, skilled global health specialists, clinicians should pay attention whether important clinical primary clinical studies are included in these practice guidelines. So for searches of relevant scientific information, I present this technical trick how to work on PubMed, how to retrieve relevant practice guidelines. You may use this abbreviation, this option of PubMed search, and add second keyword, let's say Kazakhstan, let's say COVID plus Kazakhstan, COVID plus Ukraine, COVID plus Croatia, Bulgaria, and retrieve guidelines available in for your practice in your country. So here is an example of using just two keywords, COVID-19 and practice guideline. So practice guidelines published by top scientific journals, let's say British Medical Journal, BMJ, can be also used for clinical practice as emergency sources of information. In the era of COVID-19, particularly in the first months of COVID-19 pandemic, these guidelines were also quite helpful. Here is just one example, well commented on social media, and of course, well cited. When I need information about citations, I pay attention to dimensions citations, and if I wish to have more information, I may go to Scopus or Web of Science and pay attention to these citations as well. So, social media platforms play an important role in a dissemination or emergency information. So dissemination or valuable practice guidelines. You know that, let's say, clinical rheumatologists know that any practice recommendations, practice guidelines published by Annals of Rheumatic Diseases, top rheumatology journal, immediately receives a lot of attention on social media, and over weeks and months receives a lot of citations as well. So social media is in this particular case is considered as the driver of quality, the driver of feedback, of professional interest in practice guidelines. And the more social media attention, the more related metrics, the higher quality, the higher practicality of practice guidelines. So today I know we have participants from different fields of science, practitioners, public health specialists. I encourage all of them to join social media, let's say Twitter, Facebook, and voice their professional concerns on social media, disseminate relevant information, contribute to altmetric attention score values in their field of science. So, coming to Cochrane Database of Systematic Reviews, which is the one of the main evidence-based databases, and at the same time, impact factor journal. So Cochrane Database of Systematic Reviews has published more than 15,000 systematic reviews, Cochrane systematic reviews. And again, each of these systematic reviews may be used by authors of practice guidelines and influence clinical practice. Any scientist, any PhD research fellow, particularly in clinical medicine, should go to this database, add second keyword, and consider whether there are any relevant systematic reviews. And when it comes to implications of these Cochrane systematic reviews, we do not pay attention to search strategies. Search strategies are well evaluated by their editors. We pay attention to author's conclusions. So just to learn how to use these complicated systematic reviews. So this is the last slide for this part of webinar. Again, I encourage you, all participants, to think about questions. And if there are some questions, comments, you may use our chat box, add your comments.
Thank you, Arman, for your excellent presentation on evidence-based searches, particularly in the field of global health. We encourage our participants to ask questions. Probably Professor Loncina would like to say a few words about Dr. Gasparyan's presentation. I'm sure that Professor Loncina is recognized expert in the field of ethics. Yes, and also global health.
Yeah, and we are going to learn more from Professor Loncina about bioethics. It's an emerging field of science in Eastern Europe and Ukraine. And I'm sure we'll have some publications, reviews on bioethics. But there is also public global bioethics field, global bioethics, and I'll discuss this concept of global bioethics a bit later. For now, just to remind our participants that bioethics in Western and Eastern bioethical principles may differ. However, our efforts are aimed to unite efforts of all specialists in West and East and to generate recommendations, unified recommendations for global health, for globalized healthcare. Any recommendations on ethical issues published by American specialists or Western specialists should be applicable also to scientists working in Eastern world.
Well, I think Professor Loncina will join us a bit later,
okay.
And we can move on the next item of today's program.
Okay, let me share my screen. So, good. Just to remind our participants that we have 2 short presentations by some of our participants at the end of our webinar. Now, everything is fine with my screen?
Yes, everything is fine.
Okay, good. So, which platforms, digital platforms we use for global health? So, I mentioned that global health is an interdisciplinary concept, is an interdisciplinary field of science and practice. And any clinical specialist working, let's say, in rheumatology, cardiology, always relies on principles of global health, on global health reports published by Lancet or Lancet Global Health or other, Lancet Public Health, Lancet Digital Health, Lancet Planetary Health, Lancet Regional Health. There are a number of journals discussing global health from different angles. Now, the most important for all global health specialists and for clinicians as well is to learn something new. And in the digitized world, learning is to some extent is easier because we have social media and we have free access to abundance or barrage of educational resources. And there are some of large publishers are now considering opening access to new generation or didactic textbooks. Elsevier and Springer Nature. Springer Nature publishes a large series of open access books, not journals, books. And some of these books are also educational for undergraduate and postgraduate students. So on social media, we have a global initiative which is based on arranging or grouping specialists with certain professional interests on Twitter, Facebook, and other social media channels. So these channels play an important educational or even didactic. Didactic is a hard word, but Twitter chats, Twitter journal clubs play an important educational role in global health and in many other fields of science. We also know that YouTube can be also used for educational purposes. And it's also part of open access global movement. However, not all videos on this platform are up to high standard, and discretion of viewers should be considered. Social media is an important platform for education of global health specialists because it's part of open access. There are no any restriction. Nowadays, we consider most useful platforms as those based on high quality open access. So social media platforms, particularly Twitter, with its filters, with its own rules of dissemination, is an important, validated, and reliable channel for sharing information in global health and allied fields discipline. Both students and educators may benefit from their presence on social media platforms and active stance, active dissemination, professionally interesting or valuable articles. Our participants should know about hashtags which are used, and these hashtags also help to tag tweets, Facebook posts with keywords that may attract attention. So global health specialists may use, let's say, COVID-19. It's one of the most popular hashtags, COVID-19. They can also use, let's say, rheumatoid arthritis, again, quite popular hashtag. You see this hashtag, or pandemic pedagogy, education during pandemic. The aim of education in the era of COVID-19 is to help improve patient care, to help increase quality of evidence in global health, and Twitter is considered as one of the main channels, main hubs of accumulation of basic evidence. So any information processed on Twitter channel can be also influence systematic reviews, can also influence authors who may preferentially select and cite articles with higher influence, with more citations and more social media metrics. So you can see some of our articles related to global health and social media are presented here. Of course, these articles are published again in top medical education journal. Global health specialists often rely on medical education journals to advance their didactics, their approaches to education. So medical education is one of such journals, top medical education journal. And medical educators, global health specialists also should know rules of using social media, particularly popular social media channels like Facebook. So they should have certain rules in their groups, let's say Facebook group in global health. You may also establish, open new global health group on Facebook, Global Health Kazakhstan, Global Health Ukraine, Poland, Croatia, and your group can be open, but to have more influence. If you close your group or make it private, you dissect your group from open access channels. So it's better to have any social media channel open to public, but with certain rules. You agree to avoid unethical posts, rude English language, or indecent images, photographs, or unmasked patient photographs, etc., etc. So certain rules of your dissemination should be present to have more influence, to have more ethical stance, and to attract a lot of followers to your group. And there are many other principles of having social media presence. One of the tips for having good social media presence is to avoid misinformation. And to avoid misinformation, you should distinguish evidence-based data, quality of evidence, influence of articles from a priori statements, from falsified or unethical publications. So distinguish validated and unreliable data, and disseminate or comment on these groups only on validated data, validated and or influential, supported by large professional communities articles. So global health closely relates to some allied or established fields. So we mentioned global health as relatively new subject or relatively new discipline, academic discipline. It relies heavily on health informatics, health policy, public health, occupational health, environmental health. So health informatics. When we go to Scimago Journal and Country Rank platform, all our participants are familiar with this platform. You can see that the number of journals covered in this field is quite high, approaching 300. It's quite high. And first quartile of these journals includes Lancet Digital Health, one of the leading journals in the field of health informatics. For global health specialists, for clinicians, rheumatologists, pediatricians interested in global health data, knowing about health informatic journals is quite important. So, of course, you may stick to your narrow specialist journals, let's say rheumatology or public health, but you may miss a lot of other global health journals, a lot of health informatics journals that may potentially may be useful for your practice and research. So pay attention to health informatics journals, and these journals also contain emerging data, emerging evidence. So for authors, for those who are going to write and submit to target good journals, I suggest to focus on journals published in Korea, South Korea, particularly our global health specialists working in Kazakhstan. Why? Because there are a number of good quality, well-digitized, open access journals published in Korea. And some of these journals, handful of these journals, may be good target journals for our global health specialists, public health specialists in Kazakhstan. So you see healthcare informatics research journal, somehow related to global health. And this journal is quartile 2 journal, suitable for our Kazakhstani PhD candidates. I should remind to all our other participants that in Kazakhstan, PhD candidates are obliged to publish in quartile 1 and quartile 2 journals to obtain their PhD degrees without publishing dissertation. So the more they publish in top scientific journals, the more chances of defending PhD dissertation, successfully defending. Health policy subject category also relates to global health. And each of these journals, particularly in quartile 1 journals are those with higher level of citations, with higher citation metrics, and presumably also higher level of social media metrics. Each of these journals can be considered as an individual hub of evidence-based information. and each of these journals can be searched through on PubMed platform to obtain relevant evidence. So this principle refers to global health, rheumatology, pediatric specialists, and all other specialists, not just to global health specialists. So you see here BMJ Global Health and and also Journal of Aging Studies. So why I presented this information? Because global health is a discipline concerned with patient care, concerned with longevity, concerned with quality of care and quality of life quality. So this is why global health also relates to aging or geriatric gerontology. On Twitter, these journals are well represented. And again, I remind you that you should pay attention to the number of followers. So this journal, BMJ Global Health, has roughly 13,000 followers, and the number of tweets is approaching 4,000. Lancet Global Health has a more impressive number of followers because it's just Lancet series journal, but the number of tweets is more or less the same. So these journals are influential, and global health PhD candidates should often go to this journal and cite relevant clinical trial reports, global health reports published by these journals. All other specialists should also find out whether they know top journals in their field publishing evidence-based data, and should often cite these journals. So, an example of a tweet by an influential global health journal. You see Lancet Global Health, latest journal issue, and you see how they tagged, presented keywords discussed in published articles in this particular issue, March issue of Lancet Global Health for this year. So if you frequently use hashtags, you may potentially attract a lot of attention to your journal, to your article, and influence of your articles may increase. Now, we often, as medics, rely on National Library of Medicine, and we often go to National NLM catalog to find out whether the journal is indexed by Medline. The best and evidence-based journals are covered by Medline, not PubMed Central, Medline. So you see that Lancet Global Health, as all other Lancet series journals, are indexed is indexed by Medline. And you see also mesh keywords related to this particular journal: global health, public health, and internationality. So suggesting that global health is something without geographic boundaries. So global health is for all, and any epidemiological data published in any country may be of interest to other scientists. It is true, especially in the era of COVID-19. Any case report published from Kazakhstan, from Croatia, and other countries is of global interest. So genetical factors are no longer important when we deal with infectious diseases, when we deal with COVID-19. There is no strong evidence to suggest that some nations are less prone to COVID-19. All nations, all patients are vulnerable unless they are vaccinated against COVID-19. So global health is a discipline without geographic boundaries, the same with bioethics. So some parallels between these disciplines. And now, how we search through Lancet Global Health. Again, this principle, we should use acceptable abbreviation of the journal, National Library of Medicine abbreviation. We should use this option, technical option presented here as an example, and any second or third keyword to retrieve information of local or regional interest. Here you see an article in Lancet Global Health published about HIV and syphilis, somehow relevant to Ukrainian researchers, so they should also know. And please pay attention to publication activity by Lancet Global Health. The number of articles is increasing year by year. So it's also an important information. So we may use a single evidence-based journal for searches, and we may retrieve a lot of important information. Now, there is also specialist bibliographic database called Global Health, available on EBSCO. I know that some of our participants, particularly PhD candidates, are provided access to EBSCO, but they are unaware how to benefit from that access. So PhD candidates in public health, global health need specific or particular access to global health database presented on EBSCO information aggregator. So you see that the number of articles from different journals is approaching 4 million, and roughly 5,000 journals are indexed by Global Health to offer global health specialists, public health specialists, or allied specialists with relevant information. And you see that the subject categories covered by this global health database is quite impressive. Pay also attention to journals covered by global health. World Public Health Association, other journals from US or UK, all these journals are also covered by Scopus. So Scopus is the largest bibliographic database, and taking this opportunity, I encourage all our authors from any country in any field of science to use Scopus on a daily basis, to work on their articles, to work on their dissertations, and on their lectures, presentations as well. Now, finally, about some reliable and well-organized hubs for education in any field, and in this case, in the field of global health. So BMJ Learning, I know that Asfendiyar of Kazakh National Medical University, one of the leading QS-ranked university in Kazakhstan, has access to BMJ Learning, and even undergraduate students are provided with this access. It's subscription access, but in reality, it's just free and open to most undergraduate students. So they can use searches through this specialist educational hub to retrieve articles of their interest. Those who are working in global health may also benefit from Elsevier databases like clinical keys. Clinicians may benefit. Global health specialists may benefit from Evolve Hub, its educational hub, and global health specialists, those interested in clinical epidemiology, may go to CDC platform and retrieve information available mainly from US. So some of our PhD candidates are going to produce information analytical articles, to work on information analytical studies, and they may benefit from their local ministries or statistical yearbooks of their ministries. So at the end of today's webinar, we'll discuss some examples of information analytical studies. So it was last slide for second part of our presentation webinar. Think about questions, please.
May I ask a question?
Please, Dr. Akirke from Kazakhstan.
Yeah, good evening, everyone. Thank you for your presentation, Professor Gasparyan. It was really interesting as usual. And for me, very interesting part of today's webinar, it's this part. My question, I think it's a clarifying question. So you said that not all videos in YouTube platform are up to high standard. So I want to ask, are there any official standards for such as videos? Any special standards?
Okay, Akirke, thank you very much for an excellent question. So that question refers to quality of social media platforms. YouTube is also considered as open access channel for dissemination of video articles, video presentations, and viewers may like, share, and all these activities are counted. So we may use metrics available or video level metrics to distinguish influential videos from less influential. But there is also specific methodology for grading quality of YouTube articles. And let's say in rheumatology, we have numerous articles on quality of videos. Some of these articles directly point to promotional nature of YouTube videos. If we see promotional videos, specifically pushy videos, suggesting that some drugs, some medical technologies are of high quality and there is any information about adverse effects, these videos are disqualified, considered as low quality, unacceptable for patient views. So patients may start self-treatment, and some of them may also suffer from adverse effects not covered in these YouTube articles. So YouTube analysis is a valid research study, and some of our today's participants, particularly from Turkey, Burhan Fatih Kocihit, actively publishes this type of articles. So hopefully he may also share his views. If not, then you may have a look at his articles on methodology of YouTube research.
Thank you, Arman. We have one more. We have one more questions from our participants, particularly from Pavel Abramovich from Poland. Yes, Professor Arman, thank you for valuable information on global health issues and the use of social media in publishing. I have some concern. I see potential threat in the use of social media as Facebook or Twitter in spreading the publications. The social media are vulnerable for unethical, artificial, increasing the visibility of scientific research by involvement of internet bots to increase the visibility. Do you have some advice how to prevent it?
Okay, that's again yet another excellent question from Pavel Abramovich, Bialystok, Poland, pediatrician. So he's right that some social media activities can be considered as aggressive dissemination of even quality information, even validated information, evidence-based information. Any such activity irritates viewers, irritates social media activities. Some physical users, like individual users, may also act as bots or robots, and we call them trolleys. They simply generate hundreds, tens and hundreds of tweets, Facebook mentions within a day. And these type of activities are also not so good, not so well accepted by social media standards. And some of these users may also be suspended. But we have bots with normal activities, let's say systematic review bots, informing our users of important systematic reviews published by well-established journals. So social media literacy is, correct word is social media literacy, is important for users. They should know how to distinguish active, good posts from misinformation, influential posts from social media influencers, from less important users. So social media literacy should be increased, improved to combat this problem, but journal editor credentials are also important. I personally disseminate a lot of information on articles of mutual interest, and I often consider standards, ethical standards of sharing information without any pharmaceutical drug promotion, without any medical technology promotion or COVID-19 vaccine promotion. So journal editors should know how to generate and disseminate social media posts to avoid claims of acting as robots or bots. At the same time, some journals may hire social media editors like Dr. Olena Zimba, who is one of the influential social media editors supporting several journals, including journals in the field of rheumatology. So having social media editors who moderate journal, Twitter channels, Facebook channels, Instagram channels is important. So these agents or editors know how to promote valuable information and avoid disseminating promotional articles supported by pharmaceutical industry. So these type of activities are important to combat sharing, dissemination, or pushy activities, unethical, aggressive behavior on social media space. So hopefully my answer
yes, social media, particularly Twitter, is double-edged sword. We should remember about this. If we don't have any more questions, we can move on to the next presentation on principles of quality open access publishing.
Let me share my screen and choose correct presentation. Thank you for being with us and following us. So now about quality of open access publishing. I intentionally do not use predatory open access term for this presentation because it may attract a lot of negative feedback, particularly in Ukraine, because in Ukraine we have some journals which were initially tagged by Jeffrey Bill as predatory journals charging article processing charges without offering quality publishing, without offering quality archiving. So this is why I've decided to focus more on quality of open access publishing. And to start with, I'd like to draw your attention to associations concerned with quality or ethics of open access, particularly open access publishing. All PhD candidates should be familiar with this association, International Committee of Medical Journal Editors. All journal editors from any corner of the world should be familiar with Council of Science Editors, Committee on Publication Ethics, Committee on Publication Ethics. And open access publishers should know about Open Access Scholarly Publishers Association. Publishers and standalone journals joining this association claim that they are ethical, and even if they charge their authors for publishing, they offer quality and ethical service. And last association today, I'm just briefly going to discuss and promote this association, Ukrainian Council of Science Editors. So it's a relatively small regional association. This association unites Eastern European and Ukrainian journal editors, particularly those struggling with indexing their journals. And these journals may benefit from joining membrane association, voicing their concerns, discussing their problems with indexing, and benefiting from expert opinion of other members. So the main concern of all associations is to avoid predatory publishing as a concern, as a big or global issue. All established editorial associations warn authors, researchers to carefully evaluate quality of articles, and International Committee of Medical Journal Editors in their recommendations has a specific part about how we qualify, how we classify journals as predatory, those without ethical standards, those without quality peer review, those without quality archiving, and those with pushy dissemination, those charging authors for posting their articles on their websites without offering post-publication promotion and indexing. So authors should be very careful. Well, I'll discuss Think, Check, Submit initiative a bit later, but for now, pay attention to main recommendations of International Committee of Medical Journal Editors. And PhD candidates, when you produce your dissertations or articles, carefully go one by one to evaluate one by one your references in your articles and dissertation, and exclude replaced articles which can be judged as predatory sources. So avoid citing predatory, poor quality, or pseudo-scientific journals. Open access, particularly quality open access, saves lives, and it's true in the era of COVID-19, when all publishers decided to move to emergency open access and emergency PubMed central archiving of articles covering COVID-19 points. So any article on COVID-19 published by Elsevier, Springer Nature, Wiley, Taylor Francis, and other, Duff Press and other established publishers should be immediately after publication archived by PubMed Central. And you see one of the first case series articles about COVID-19 in Wuhan with astronomically high automatic attention score and quite high tweets, impressive more than roughly 28,000 citations on Dimensions platform, and also quite impressive bookmarkings on Mendeley platform. So pay attention to these metrics when you deal with global health, rheumatology, pediatrics articles. These metrics are valuable. So we may rely on these metrics to judge influence of articles. If not evidence, then at least influence of articles. Sometimes influence and evidence are considered as interchangeable terms. So, and I also would like to draw your attention to principles of open access. Open access includes quality open access journals, quality preprint servers, institutional repositories, which are important in Croatia, in Eastern Europe, in Kazakhstan, in countries where the number of index journals not high, and they wish to increase visibility of their articles, they may include mandate of institutional repository. So the best country in EU is Croatia, with well-established institutional or university repositories. So social media networks are also considered as part of open access, particularly Twitter, which is openly available to public attention and openly disseminates valuable information. Free databases or platforms like PubMed Central, like directory of open access journals. These databases are useful for open dissemination. Permanent archiving, PubMed Central is considered as the most important and high quality repository or archiving platform for open access articles. Open peer review. We know about Publon's platform, which is part of Web of Science. In this platform, Web of Science, Publon's platform is used for post-publication commenting, and it influences automatic attention score. And of course, IDs, digital object identifier for articles, electronic ISSN for journals, ORCID, Open Research and Contributor ID for individual researchers, and there are also some new IDs for affiliations. So I'm not going to discuss the latters, but you should know that there is a diversity of identifiers. Today, I at least ask you to register freely with ORCID and have publicly accessible information about your academic activities on your ORCID IDs. So one of the influential editorial association or publishers association has roughly 140 members, and these members are large publishers, ethical standalone open access journals, small publishers, institutions, universities, adhering to best principles of open access. All participants should know about definition of open access. I use this simple definition, which is considered by open access scholarly publishers and other influencing influential organizations in the field of open access. So open access is a means of disseminating scholarly or scientific information which is not based on subscription model. It is incorrect to publish open access journal archived by PubMed Central and to have additional subscription model. Some Eurasian journals still have this concept of open access, paradoxical or unacceptable to most experts. So if a journal is for open access, there shouldn't be any subscription. And the main platform for dissemination of open access should be national library, like Vernadsky National Library, PubMed Central, which is also considered as a repository, or other repositories, large archiving servers, let's say Cyber Leninka in Russia and Eurasia, it's also used. So we should understand basic principles, and we should know that open access is to accelerate scientific innovations, to improve quality of education by improving quality and digitizations of presentations. There are a number of implications of open access publishing. Quality systematic reviews, because authors use primary research and they need access to most quality resources. If our authors are concerned with Kazakhstan, Ukraine, I would encourage them to use Scopus, PubMed, and combine these searches through these established databases with searches through directory of open access journals. We'll discuss a bit later. So quality peer review also may benefit from open post-publication peer review. Publons offers that option. And if journals open their peer review kitchen, peer review processings, pre-publication peer review processings to public, offer open access to peer review on Publon's platform that also helps to increase transparency. So research impact increases, multiplies, it allows to multiply citations and social media attention. So traditional and alternative metrics increase thanks to open access, quality open access. Academic promotion. In Korea, individual scientists are ranked based on their social media activities, based on altmetric attention scores of their articles, not just citations, but also social media metrics. So, and in the era of open access, we often deal with corrections and retractions. And I think that analyzing retractions is a quite useful experiment, quite useful study design, allowing others to avoid the same mistakes. History of open access. It all started in Budapest in 2002 to increase visibility and dissemination of quality, reuse of quality scholarly documents. So there are three basic three pillars of open access, three documents, declarations. Budapest Open Access Initiative, dealing with self-archiving or quality archiving on PubMed Central, on National Library on Vernadsky National Library, other regional libraries or other established archiving servers, and quality open access, ethical open access. So articles for immediate open access, immediately after publication offered for open access, also considered as quality, as adhering to basic principles of open access. So our participants should know about Budapest, Berlin Declaration, principles are the same. So let's say Berlin Declaration, it's a continuation of Budapest Declaration. So authors should retain all rights for their own articles. They should have right to disseminate quality articles, but they should know that it is also essential to archive their articles with PubMed Central, with other reliable digital repositories, or at the least, they should know that their articles in PDF or other formats should be machine readable, should be easily processed by information aggregators. And some journal editors may also think about increasing XML conversion of their articles, of published articles, offering archiving services or contacting archiving servers to increase visibility. So Bethesda statement or Bethesda declaration also deals with open access. So this is the third important declaration in the field of open access publishing, and it's now part of structured keyword introduced in 2016. It's now called open access publishing as a structured keyword. So all open access journals should have principles based relying on Bethesda statement on open access. Please go to that statement and learn more. Open access, when we search through Scopus, we find just roughly 2,000 articles, and some of these articles deal with social media, information dissemination, access to information, citation analysis. So these are related keywords related to open access. Again, leading countries in the field of open access publishing are United States, United Kingdom, Germany, Canada, Australia, India. Ukraine has just 4 articles. It's too low. Why? Because experts in information retrieval or in global health lack understanding, lack perceptions of open access importance. So I again encourage all our participants to better understand open access, basic principles of quality open access, and do research in this field, share information, do online surveys, and benefit from open access channels like Twitter, like Google Forms, open sharing platform for online surveys. So there are some influential authors in this field. I am not going to discuss these influential authors, but more important is where all these authors publish. They publish primarily in Nature. So Nature is the top scientific journal. If this journal is concerned with quality open access publishing, it means that its articles in this field represent something, represent evidence, or represent professional community feedback. There are some influential articles in this field with high citation metrics. Again, I'm not going to discuss these articles in detail. Simply, these articles are well discussed on Twitter channel, by news outlets, well bookmarked on Mendeley platform, etc. I mentioned about PubMed Central as a reliable quality hub for open access journals, archive or repository for open access journals. Currently, there are 3,140 journals. Exactly this amount of open access journals participating with National Library of Medicine in archiving initiative. And most of these journals come from influential publishers like BMC, Biomed Central Publishing, like Dove Press, or other open access, exclusively open access publishers. All other specialists, journal editors should know that their journals should be permanently archived somewhere. Those using open journal system should know that all their articles automatically archived by LOCKSS hub, LOCKSS platform, or CLOCKSS, more advanced platform. Those authors who are going to publish in startup journals, they should pay attention whether the journal is somewhere archived or permanently preserved. Most predatory open access journals charging their authors do not have any permanent archive for preserving published contents. Once they discontinue publishing, all their archives will disappear. So authors should also know about where archives permanently preserved. You see that even a top rheumatology journal, which is considered as hybrid journal, transformative journal, from subscription to full open access, also covered by LOCKSS and by PICO. These are permanent archives. Now, about directory of open access journals. It's an influential, in the most important directory, whitelist of open access journals. And the number of journals covered by this directory is increasing day by day. Each day, they increase by 10, 20 the number of covered journals. And you see that the number is fast approaching 18,000. In the field of, there is now search option. You can find out which open access journals do not charge their authors, particularly English language journals. You see that the large majority of open access journals, more than 12,000 index journals, are without article processing charges. So these journals are called platinum open access journals, without open access charges. In the field of medicine, there are roughly 2,000 journals without open access charges. So good for our participants, because participants in Kazakhstan, in India, those without research funding cannot publish in gold open access journals. So all ethical journals should have waivers for those who do not have funding for open access. All good or ethical journals should clearly, transparently present on their websites if they charge article processing charges, why they charge their authors for archiving, for editing, for quality of services, or for post-publication promotion. So these should be presented. Journals charging their authors at the submission, or so-called pre-submission charges, charging without accepting and leaving authors confused why they charge. It's also unethical, unacceptable for directory of open access journals. Directory of open access journals disqualifies journals that cooperate with bogus or unethical indexing services without international reputations. Indexing services that charge journals and generate bogus journal metrics. So be very careful. It refers, this comment refers to journal editors applying to DOAJ. So leading countries with large number of open access journals are Indonesia, United Kingdom, Brazil, United States, Poland, Iran, and also Ukraine. You see that in Ukraine there are roughly 400 journals, and our moderator is also associate editor of director of open access, and I am sure she uses her knowledge and skills to increase bar of acceptance at DOAJ, to accept only ethical journals. So in Kazakhstan, there are just 18 open access journals qualified as quality or ethical open access journals. And these journals are published by large universities like Kazakh National University in Almaty, Al-Farabi National Universities, just general, and also some small universities, other universities. Here is an example of Kazakhstani journal covered by Scopus and DOAJ, considered as ethical journal. However, you may find that this journal charges around 100,000 Kazakhstani tenge, it's roughly $2,000 per article. So, and they officially, transparently disclose this information on their website. And they also claim that there are any discount, any waiver. Accepted article authors should pay publication charges. They pay attention, they use CC BY license for dissemination, and surprisingly, they also claim that author does not retain unrestricted author copyrights. So to me, it's rather strange, but DOAJ experts accept this type of journals as well. So, and you can see that this journal is published by large university, Al-Farabi National University. So this is good example of acceptable DOAJ acceptable journal. You see now examples of Twitter platforms of DOAJ, the main platform and platform automatically disseminating information about DOAJ covered journals. You see more than 300 tweets from September 2021. So this number of journals are covered, recently have been covered by DOAJ. Their journal applications were successful. Now, there was good online survey in the era of COVID-19 recently among roughly 300 participants, and surprisingly, specialists in orthopedics and traumatology responded that only 21% have heard about this important directory. Hopefully, all our today's participants know that DOAJ is whitelist of open access journals, and it's also search platform. They also were, some of them, 1/3 of respondents were unfamiliar with Think, Check, Submit initiative. That also surprising to me, because all should know this initiative. This initiative is an important for authors, editors, and all scholars. you can see that before submitting to their target journals, the authors should know about ISSN, peer review model, where the target journal is indexed. They should find metrics and citations transparently presented on journal, at least article level metrics. They should know whether the journal is indexed by DOAJ or not, whether other editorial associations are related to this journal, let's say Committee on Publication Ethics, and is there any publisher or supporting this journal. This is why I often suggest startup journals to associate with large association, with large university, and with reputable editorial association, let's say Ukrainian Council of Science Editors. Now, this initiative is well represented on Twitter. Number of followers is more than 4,000. Hopefully all today's participants will follow this initiative on Twitter, will join, will open Twitter channel and follow this initiative. It's important for global health specialists, for all specialists who would like to publish in open access journals. Now, good example, Central Asian Journal of Medical Hypothesis and Ethics. You see this journal is now indexed by DOAJ and some other databases, particularly chemical abstract service databases. There are some databases of importance to pharmacy, pharmacology, toxicology, biochemistry specialists. So why I am emphasizing this? Because today we have representative as a participant, representative of Ukrainian Biochemical Journal. The journal is also covered by Chemical Abstract Service. Other journals, startup journals may also benefit, may also submit their applications. Biology, allied health journals, global health journals may also benefit. Because in America, a lot of specialists use platforms, CAS platforms for searches, for systematic review searches, etc., etc. And you see this example of article well promoted on social media, and all these metrics are available on journal website. So this journal can be considered also well digitized, well promoted for increasing attention of readers. I hope that you know about Sarajevo Declaration. It was published in 2016 by Croatian Medical Journal to increase awareness of the importance of ORCID IDs for authors, reviewers, and editors, and to increase transparency of national journals. So for all national journals, it's important to enforce ORCID mandate, to ask their authors, reviewers, and editors to register freely with ORCID and provide ORCID identifiers. These identifiers are integrated with Publons, with a number of digital libraries, databases, can be integrated, these profiles, with Scopus author IDs, etc., etc. And of course, Publons platforms is also part of quality open access, part of transparency, and now it's part of Web of Science. Journals who applying to Clarivate Analytics, to Web of Science indexing, should have also proper representation on Publons platform. You see that some journals have open pre-publication peer review policy, and they simply forward peer review comments automatically to Publons platforms. All others should consider journal policies related to pre and post-publication commenting. Of course, post-publication commenting is free. Any reader can comment on article on Publons profile, and it can also influence Altmetric profile. Now, about individual journal profile on Publons. Pay attention to the number of reviews, to the number of endorsers, and increase this number. It's important, again, for journals applying to Web of Science. All today's participants, please go to profile of this journal platform, and if you're sure this journal is ethical, please endorse it. All our participants may also benefit from ResearchGate. It's social networking initiative, social platform, and it also allows to archiving PDFs of your articles. So it was last slide for this part of presentation. Hopefully these bits of information, advices could be also implemented in any country, particularly in Central Asia and Europe, and may benefit our participants.
Thank you, Armen, for valuable information. I see that our colleague and supporter, Professor Jerzy Konstantinovich from Medical University of Bialystok, would like to say a few comments on your presentation. Professor Jerzy Konstantinovich, can you hear me? Oh,
thank
nice.
you, Elena. Thank you. The amount of information was perfect and was really, really useful. And just a short comment regarding your most recent two presentations regarding the digital tools and the open and free platforms for research and education, and also open access ethical journals. So all those you've been talking about, Armen, provides a unique and fantastic opportunity to overcome the inequalities. And you have highlighted this. So the scientific world should be fair and should share the information in a fair way, not just the competition, but the justice in the access to the knowledge and new developments, new implementations, new drugs, new protocols. That's why I appreciate very much you have highlighted the how to overcome and to alleviate inequalities for low-income regions, for those who have a gross product, domestic product, very substandard. And this is the point number one, what I wanted to highlight. And I absolutely share with your thoughts. This is a new approach to this science, I think, because sometimes we think there are only leaders. Again, we should promote talents around the world in a fair way. I mean, in a very using some justice criteria. So thanks a lot for that message and your approach, what you've really systematically teaching us about. The second question is very, very short question, just linguistic one. One of my young colleagues, a chemist from King's College London, he's a Pole, he's a Polish PhD postdoc, but resident of London-based resident, and he's studying chemistry and he's teaching chemistry. He told me about semi-predatory journals. Semi-predatory journals. Is something like that? Does it exist? Or pseudo-predatory, predatory, and semi-predatory? So half-half. Could you comment on these just briefly?
Okay, thank you. So your first question was about inequality in open access, and the second about semi-predatory journals. So first of all, inequality, you fully commented on that issue. I just would like to add that inequality in open access somehow relates to poor digitization. So journals in Ukraine, in Kazakhstan are poorly digitized and deprived of PubMed Central, deprived of reputable databases, deprived of ProQuest information aggregator, which also archives, aggregates abstracts of articles. So journals in these countries are deprived of access. So it's unfair it's not fair that a lot of journals, even good quality journals in Ukraine, Kazakhstan, and other European countries are deprived of access to PubMed Central. Partly it relates to low funding, but the editor should know that XML conversion, JATS XML conversion for PubMed Central, it's now for a reasonable charge. So inequality in open access relates to poor digitization. I attempted to increase awareness of our participants of open access initiatives. Open access initiatives related to DOAJ and think, check, submit. If our participants know about these components of open access, it's okay. So they are more literate field of open access. Second point is about semi-predatory journal. There is no such thing as semi-predatory journals. There are good journals indexed by reputable databases, Medline, PubMed Central, and there are bad or substandard journals. All these journals are considered as poor quality, unethical, and there is no need to submit anything to this journal. So we should submit only to journals archived by PubMed Central, indexed by DOAJ, indexed by Scopus, Web of Science, and also by local directories.
Thank you. Thanks a lot. Just a very last comment, a very last question regarding the correspondence, but no, not just correspondence. What do you think about the post-publication tweets and Facebook discussions and exchange of thoughts and reflections? Does it replace the commentaries and letters to the editor in the journals, or it's a parallel world? Because it's very strange to me if you publish a commentary or just a letter to an editor, it's something really more responsible. It needs higher quality, not just a free, what's your opinion? Or maybe Vasyl Lonchina will also join us to comment this, his personal opinion. And that's it.
Okay, thank you, Jurek. So I'll briefly comment and pass on to Professor Lonchina. So letters to editors are difficult to write and difficult to publish. They should contain a rational point and they should be structured as letters. And they need also references, whereas tweets, Facebook mentions can be published quickly, particularly by busy clinicians, and they do not need any reference. They simply represent expert opinion. But there are no any aggregators processing these tweets, these microblogging activities. Anyway, professionals like you and others should know any tweet influences article, automatic attention score, or other social media metrics. So it's also professional tweets are a service to profession. Thank you. So Professor Lonchina, a few words, if you wish,
Armen,
to comment or to continue.
Yes, Armen, thank you again for this series of wonderful lectures. Every time we learn something new. For instance, this new evidence pyramid, something I've not heard of, and I'm happy to have learned about it this time and delve into it. A very interesting take on this, evidence-based medicine. Just to go back, circle first to the last question about social media and its effect on publications. I look at social media as simply a billboard that brings to our attention certain articles, but really we have to go to the original source, that is to the article itself, to know the quality and the depth of knowledge that it presents. I think that relying on blogs and Twitter simply to maybe make popular something may fail, because in the end, if you really are looking at this with a jaundiced eye, you will look at the article itself and say whether indeed it has value or does not have value to your practice or to your research. So again, Facebook and Twitter, great to bring attention, but not necessarily the end all. And if I may just simply go back a little bit to the beginning when you talked about global health and practice guidelines, et cetera, I don't think that we need to necessarily reinvent the wheel. The practice guidelines have been made, have been researched, have been vetted multiple times by multiple institutions. And I think it behooves many of our countries, Ukraine and maybe other Central Eastern European, Asian countries, to look more closely at these and to incorporate them into their practice rather than trying and develop their own. Yes, there may be some variations on a theme, but if we're talking about global medicine, global health, we're talking about international standards. That's what we should strive for. That's the gold standard, and we should come up to it and not invent a new standard. I see this. My experience is only with Ukraine, and to give you an anecdote of what one former assistant minister of health said about Ukrainian medical practice. He says, if you have a list of the 10 most frequent diseases in Europe, this is the list. If you take a look at the list of 10 most frequent diseases in Ukraine, it matches, it's the same. So diseases do not change from country to country, continent to continent. However, if you look at the treatment for these diseases in Europe and you compare that with the treatment of these diseases in Ukraine, they markedly differ. And so therefore, there's plenty of room here for improvement. And I won't have to belay the point on whose part there should be improvement. I think we need to get away from very traditional. I mean, there's nothing wrong with traditional, but I think that some of us may be hung up on very, very traditional homeopathic methods without looking at international, because we grew up in a system that was very self-centered. It did not look to the outside, and therefore did not mature in its thinking because of this medical intellectual imprisonment. So therefore, that's why I think it's so important that we look at global health, and for researchers, this is so important that that you look at international papers. I review so many papers that are loaded with their own references, references of their region. That'll never make a springboard towards the international scene. It will never match international standards, and will always be, a lower value. So therefore, our researchers have to look outside the box, look into the global literature, and utilize this in their work. So those are just a few of my comments.
Thank you, Professor Loncina. We have one more question from our colleague from Turkey, Burhan Fatih. This question is about YouTube. Dear Armen and Olena, first of all, thanks for this great webinar. What is your interpretation in terms of evidence-based medicine for case-based pooled analysis? These articles present similar cases on important databases in the literature. And his comment for YouTube studies, our studies showed that high-quality videos are not the most watched videos. Therefore, the focus should be on video sources rather than the number of views. Physicians, academics, and universities. One moment. are the main sources of the high quality videos. In Turkey, some academics consider open access journals to be prone for predatory publishing. What are your comments on this subject?
So first of all, Burhan Fatih Kocahit is one of the prolific authors in the field of rehabilitation, physical medicine and rehabilitation, and he published some articles on YouTube evaluation. And I remember that he, in his articles, he pointed out that video articles produced by reputable universities, reputable organizations, regardless of their citations and social media metrics, are of high quality. I couldn't agree more with this point. Also, about predatory open access in Turkey. We should increase awareness of quality open access among all rheumatologists, PMR specialists, and other specialists, global health specialists in Turkey and other countries. Why? Because with increased awareness of quality open access, there will be much less chances of publishing with predatory or poor quality journals. So we should invest more, and we should organize more online surveys of specialists to evaluate their awareness of quality components of open access publishing, to find out whether Turkish specialists know about DOAC, about Think, Check, Submit initiative. So these type of activities are useful for increasing chances of publishing with quality open access journals. We should also discuss countries with successful implementation of open access. Croatia is one of the leading countries in Europe with high number of open access journals. I know that Professor Konstantinovich could argue that Poland has much more open access journals. Yeah, I'm well aware, and based on numbers of Polish journals on DOAC, Poland is one of the leaders in Europe. But of course, there are some concerns with Index Copernicus database, Polish database, which was tagged by Jeffrey Bill as predatory metric issuing agency. So I am not going to discuss this sensitive issue. We should ask Jeffrey Bill why he tagged, why he mentioned this database as predatory. However, we should simply increase awareness of our users of the importance of databases, archives like PubMed Central. If a journal is archived by PubMed Central, chances are high that this journal is good quality journal, even without any indexing. PubMed, Medline, Scopus, Web of Science, etc. So we should increase also awareness of Scopus, DOAC experts of the situation in Turkey, in Ukraine, in Poland, etc. I know that in Ukraine, most journals suffer because of poor organization of work, because of poor organization of editorial work. There are only a handful of Ukrainian journals have statistical editor. Without having statistical editor, you cannot increase quality of statistical data presentation, and you cannot convince Scopus experts that your journal is suitable for Scopus coverage. Also,
Armen, you mentioned about statistical data presentation. This is the most complicated topic of today's webinar.
Yeah, we should move to that to discuss this final topic of today's webinar. And if you allow, I'll start sharing and start discussing this topic. Questions and comments can be after this final part. And just to announce that we also have 2 presentations by our young participants, Kazakh ladies, who are going to impress us with their style of presentation. So let me finish my part.
Yes, please share with us your screen.
Okay. So to be honest, it's the most difficult part of today's presentation, today's webinar, because there are a number of points related to mathematical analysis, and not all medics are good at statistical analysis because they are not good at mathematics. But as editor, I often use my own approach because as editors, we should have some editorial credentials, some knowledge of statistical data presentation and analysis. And if we evaluate articles, in-house evaluation allows us to find out whether there are some errors or mistakes with statistical data presentation and discontinue evaluation process. So now, again, International Committee of Medical Journal Editors has some points about statistical data presentation and interpretation. World Association of Medical Editors has a strong group of statisticians, members of this society. And one of the past presidents, Farooq Habibzadeh from Shiraz, Iran, he is also one of the leading statisticians who published some great articles, and I often disseminate these articles to increase awareness of quality statistical data presentation. And Retraction Watch, from time to time, discusses retracted articles which contained statistical errors in their primary analysis, so in article analysis. So at this point, my message to journal editors, please have statistical editors as part of your editorial teams to evaluate manuscripts before acceptance. And our researchers in any field of science may benefit from following Retraction Watch on Twitter, Facebook. Please join and follow. And you can also retrieve information about retracted articles from PubMed and Retraction Watch database. There is specific database of retracted articles. So you as editors should also know something about statistical tests. Which statistical tests are essential? Some Western or Oxford-based statisticians suggested to have flowchart or checklist to assess statistical papers. Quite a lengthy list of points related to statistics. Let's say each article should be evaluated from statistical point of view, whether valid statistical methods and assumptions were used, whether correct correlation tests were used, and a number of other checking points. So all these points are important. I'm not going to argue with these authors, particularly with deceased Douglas Altman, Oxford statistician who deceased in 2018, and his article was published years later. You see this example, and he was still included as author of this article. So data presentation is important. Checklists are important. Statistical advisors at journals should use this checklist and should bear in mind this checklist when they evaluate articles. But for all other editors, non-statistical editors, the most important basic point is to understand distribution. And for medical journals, for medical editors, the most important point is if we deal with small samples, less than 100, less than 50, it depends. Chances of having not normally distributed data are low. Usually, normal distribution, you see this bell-shaped normal distribution, is quite rare in biomedicine. In reality, it's quite rare. However, we may transform our not normally distributed data, so-called logarithmical transformation, and to have log transformed distribution, which is also considered as transformed distribution. It's for statisticians. So you see number 20, whether these graphs are suggesting normal or not normal distribution. For that, if we are not sure if our visual evaluation is not enough, we may go to Kolmogorov-Smirnov or Shapiro-Wilk. Shapiro-Wilk test is more commonly used nowadays. Shapiro-Wilk test, and clearly have answer whether our distribution is close to bell-shaped distribution, and then employ statistical tests, related statistical tests. So in biomedicine, we rarely have normal distribution, so we should rarely or never employ student t-test, Pearson correlation, and when we have multiple comparisons, ANOVA test. We should never use ANOVA test for multiple comparisons. So everything depends on distribution of data. In your statistical analysis, authors should have information, a line about how they tested normality of distribution of all parameters. So you see some good example from good journal, relatively good journal, and you see comparisons. And you see they presented data as median, minimum, and maximum. So it's acceptable for not normally distributed data. However, CRP, C-reactive protein, is presented, you see, incorrect presentation. Statistician immediately picks this minor mistake. You see, mean value 49 and standard deviation are close to each other. It's eyeballing that there is something inherently wrong, mistaken. So it's better to present C-reactive protein here as median and minimum and maximum data. Here, I am not sure, but most probably this parameter in this group is normally distributed because standard deviation is quite low compared to mean. Another mistake, again, here 27 and 20 are close to each other, eyeballing that there is mistaken presentation. It would be better to present as median, minimum, maximum. And nowadays, we more and more use Spearman rank correlation coefficient. However, in this case, authors used Pearson correlation for linear variables. I am not sure whether it's correct. I would go for Spearman's rank correlation coefficient. So my approach is different and based on on testing distribution. So you see that they claim, these authors, Chinese authors, claimed that they used Shapiro-Wilk test to test normality, and then they present data, not normally distributed data, as median and interquartile range without ascertaining whether interquartile range is a single number or a range. Last border, a border of 25 quartile and border of 75 quartile. So it's quite confusing. This is why I suggest, for simplicity, to report median and minimum and maximum, range between minimum and maximum for not normally distributed data. And they claim that they used Mann-Whitney for not normally distributed data or two-sided student t-test. For these small number of patients, 19, 12, 40, 50, it's more appropriate to use Mann-Whitney and to report as medium and minimum maximum. So it's Italian journal in rheumatology, and there are just minor mistakes, but statisticians would correct me. Now, about Farokh Habibzadeh, I met this guy in Shiraz 12 years ago in Shiraz, Iran, and we discussed a lot about statistics, about journal editing, and after that, years later, I invited him to publish statistical data editing opinion piece, and it's quite influential opinion piece. You can read it and learn a lot. So about p-values, first of all, p-values, they suggest these are just statistical parameter, and it can be used and interpreted with care, carefully. First of all, he mentioned about precision. There is no need to play with precision when it comes to p-value. It's better to simply report p below 0.05, and it's enough, or p above 0.05. Here you see common mistake of presentation, p-value presentation, when you report it as equal to 0. P-value cannot be equal to 0. You should simply report 3 digits after decimal point and put it 1. P value, P equal to not, or P below is below 0.001. This type of presentation, reporting p-value, is more correct. So, but remember, when you report p-value solely, it's again insufficient, not enough. You need to find out whether your SPSS or other statistical packages generate other metrics, generate 95% confidence interval. Now, the Ukrainian Biochemical Journal, some data. You see that they presented p-values, compared COVID-19 patients with healthy individuals. Everything is okay, except with presentation of medians and interquartile ranges. It would be better to present these values as median, minimum, maximum, because I am not sure whether these parameter is normally distributed. We should also be careful with precision. Try to omit zeros. Instead of, you should use zero values, particularly here, not 0.20, or why not to present it not 0.2? And when you report values of p-values also, try to be to avoid precision. Simply put p-value below 0.001. And these statistical data allowed authors to draw conclusion based on p-values. To some extent, it's acceptable, but International Committee of Medical Journal Editors suggests that that's not okay. And there is also another mistake here. First of all, the authors did not report how they tested normality. They used some students' t-test, which is not inappropriate for small sample sizes. So I would suggest the editors of this journal to hire a statistical editor to evaluate articles prior to acceptance. And I, of course, would encourage them to join Ukrainian Council of Science Editors to frequently comment, discuss issues related to quality of their articles. Another local example, Medicine Perspective journal. Both journals are covered by Scopus, but both journals have a number of problems, small minor problems, mistakes with statistical data presentation. You see, they presented data here. Of course, they reported 95% confidence interval. But why we need these 95% confidence intervals here? If it comes to total protein, radiation therapy, and we should think about clinical meaning of these data, whether total protein changes before and after radiotherapy significantly changed. No, these data are statistically not significant. You see, let's say this particular example, or urea, the same value, 4.5, 5.5, and no information about 95% confidence interval. I'm not sure why they present it here, not here, and whether these data are of clinical importance or not. So it's important data. Always ask authors to report how they tested normality and which type of tests they used, and whether statistical data presentation has clinical meaning. I would simply omit this data because any changes, total protein or creatinine or other general laboratory parameters have clinical meaning. More specific, more related to radiotherapy tests would have meaning, but all these without any statistical significance, I'm not sure whether they have or not. So clinical and statistical differences, meanings are two different things. When it comes to 95% confidence intervals, we should pay attention to values, mathematical values. We should simply know that 95% confidence interval and odd ratios should be somehow related. If odds ratio is in between this range, you see 3.4 is in between 2.5 and 4.3 in arithmetical mean, somewhere in between these ranges. So it's okay, there is nothing wrong, and there is statistical significance of an association. If you see 95% confidence interval is too wide range, it means that either your sample size is too low and 95% confidence interval suggests that there are some inconsistencies, or your data are incorrectly processed. So pay attention to arithmetical processing of 95% confidence interval, and pay also attention that if you see statistically significant range, 95% confidence interval, there is no need to report p-value. Our authors often report p-values to show that they have a lot of data, but there is no need. If you have 95% confidence interval suggestive of statistical significance, that's enough. Here are good examples of statistical significance. So, about recommendations, finally, we are coming to recommendations of International Committee of Medical Journal Editors, suggesting that we cannot rely on p-values only. In global health, public health specialists often report chi-square test or Fisher's exact test, and often report p-value. Other than that, there is no need to use p-value and draw conclusions based on p-value only. Whenever you can, always report 95% confidence intervals. Whenever you can, use other tests, let's say logistic regression analysis or linear regression analysis. No need to draw conclusions based on simple or student t-test or Mann-Whitney U-test. Now, about chi-square test. When you have proportions, of course, you can also present proportions as linear parameters, but it's better to use these as categorical parameters, nominal parameters with percentages. So let's say smokers, non-smokers, male and female gender. So you may find associations, whether there is any associations between smoking and gender. And in that case, you can use chi-square or Fisher's exact test. So your statistical package will tell you which test can be used. So here is an example. You see, again, eyeballing. 31% here and 7% is here. And of course, p-value is equal to 0.001. So you see statistical difference, and even without processing via chi-square test, we can judge that this difference is probably statistically significant. But for mathematization, we also need statistical test, chi-square, chi-square. And it's used for nominal, not linear data parameters, not linear or nominal parameters, family status, smoking status, comorbidities, presence or absence, etc., etc. So global health specialists often use it, and they often omit information about precision. When you have small samples, when you see here numbers are below 5, most probably these proportions are compared by Fisher's exact tests for small sample sizes. So you should know about it. So here also we see just 4, and these chi-square Fisher's exact tests are 4 by 4. You will see in a bit 2 by 2 tables tabulation test. So an example to understand better some mistakes. So percentages in group 1 and group 2. Of course, there is no any difference, 3% and 5%, even without calculation. Treatment, you see in one group, 45% and 80%. Most probably these differences are statistically significant. So we need to use chi-square test. And the numbers are impressive. So most probably chi-square test would be used. So let's say here, whether chi-square or Fisher's exact test. So our statistical package will automatically use and guide us. Most probably Fisher's exact test will be used. So this is why when we report in statistical methods, statistical analysis section, we simply mention about both tests, whether one or another is used. But you see some incorrect reporting. It's reporting by Kazakhstani fellows in an Iranian general medical journal. Why we need to report p-values below 0.005? Why not to have 0.05? So inappropriate precision in this case suggests that the authors wrongly calculated. This is why some journals now have mandate, open data availability mandate, open data sharing policy. So all Ukrainian journals, all journals should have that policy. And it's important because statistical editors may request primary data to process themselves and to find out whether results or whether p-values are the same. So this type of reporting suggests that reanalysis is necessary. Another example, this time from Ukrainian journal. Of course, the authors suggested that they use student test, Fisher's exact test. I doubt that there is everything is okay in this article. Okay, I pay attention to numbers, again, 12 and 13. And the authors calculate percentages. When you have small sample sizes, drawing conclusions on Fisher's exact test, not so appropriate. Fisher's exact test for small numbers, and for powered conclusions, we need powered analysis, chi-square test, larger sample sizes. So probably sample size calculation was omitted in this study. So first of all, authors should calculate sample size. And if they didn't calculate, they at least had to a priori increase number of samples to have statistical significance, to have data acceptable, processed by chi-square. Okay, chi-square test is easy to calculate, and simply we need to put in category 1, we need to have category 1, smoking, non-smoking, and groups, male, female. And we may also choose Fisher's exact test if in one of these tables numbers are below 5. It's that mathematics. So, but usually SPSS package or other packages, Prism or other packages with the number STATA, they automatically process and give us data. So be aware that SPSS is the easiest way, it's my own opinion, easiest way of calculating chi-square. Though it's 2x2 test, but we may also have grouping above 2, 4 groups or 5 groups. In that case, the situation is different, but again, SPSS or other platforms allow us to calculate chi-square. Now, if you deal with small samples and it's biomedical study, you should use Spearman's rank correlation. The power of Spearman's rank correlation, because it deals with rankings, lower compared to Pearson's correlation, bivariate correlation. We compare association between two linear parameters. Spearman's rank correlation should be frequently used in biomedical research studies because of small sample sizes, and we need to report it as a raw. Spearman's rank correlation coefficient. So we usually compare not normally distributed variables, even if one parameter is normally distributed and another one is not normally distributed, we still need Spearman's rank correlation. And pay attention whether your variables are continuous or ordinal. Let's say in rheumatology, we use visual analog score, 1, 2, 3, up to 10. And we may, or even if it's 100%, again, 10, 20, 30, etc. Again, there are ranks. We presume that VAS can be transformed into linear parameter, but it's still ordinal. And of course, we may also calculate scatter plots. More and more trendy. Scatter plots are becoming more trendy. I'll show in a bit. So Dr. Olena Zimba presented this example. She analyzed tweets and citation metrics in one of the good journals, Journal of Korean Medical Science, cross-sectional analysis of more than 400 documents, compared altimetric attention score, and tried to find associations with citations. And you see this scatter plot suggesting that there is strong linear association. Raw Spearman's rank correlation is strong, above 0.6 and statistically significant. We report this. And most probably there is linear correlation between Mendeley bookmarkings and Scopus citations, altmetric attention score values, and tweets. Again, we see that our scatter plot suggests that there is strong linear correlation. Now, about logistic regression. We may use logistic regression, again in biomedicine, when we deal with a number of confounding factors in global health studies. Even if we consider, let's say, smoking, non-smoking, these binary parameter dependent on a number of independent variables, hypertension, social status, binary and linear parameters. So we, in logistic regression models, we need to know about dependent variable, smoking, non-smoking, and independent variables. And we may subsequently we construct regression models based on knowing dependent and independent variables and using crude and corrected model. In crude models, we find out association without putting all independent variables. And when we see statistically significant associations, we try to include in corrected models only statistically significant variables. Let's say hypertension or obesity or hyperlipidemia, etc., etc. And again, we should pay attention to odds ratios along with 95% confidence intervals, where odds ratio values stands in between 95% confidence interval ranges or not. So examples. Good example presented by Kazakhstani global health or public health specialists. They analyzed loneliness in association with disability. Disability status, again, yes or no, binary, is independent variable, but there are a number of confounders or covariates, age, gender, comorbidities, etc., etc. And they find out, presented good data, odds ratio 1.8, and you can see that in this first example, it's in between 1.5 and 2.2. So disability is associated in crude model with loneliness. So it's okay, but it's just crude model. They also mentioned about several corrected model 1, model 2, and model 3. And of course, association, when we include more and more confounding factors, value of odds ratio decreases and association is decreasing as well. So odds, likelihood, probability, chances, we should pay close attention to odds values and whether it's eyeballing. When you pay attention to these odd values and 95% confidence intervals, you can say whether it's correct or not, whether it's statistically significant or not. Here is example, bad example. You see odds ratio 0.1, confidence interval 2.2, 2.8. Odds ratio is beyond that range, but they presented it as statistically significant. So it's not incorrect. So this example was published by Turkish scientists in good journals, and the article was retracted, and it was because of editors' mistakes, because at the beginning, in-house evaluation didn't notice that basic mistakes of reporting odds ratios. So, and if we have odds ratios, there is no need to report p-values. Here is retraction note of this article. Basic mistakes, they presented it incorrectly. And even without statistical data, we may guess that there is something wrong. Breastfeeding, mastitis, and use of dairy products by breastfeeding women. So you see these data, even clinicians or even just any researcher may spot these basic mistakes. So often editors fast process data, manuscripts with good English text, with good references, without paying attention to statistics. So pay attention to statistics, pay attention to odds ratios, and often use odds ratios you may interpret odds ratios above or below 1. If there is relation, so it's above, it depends. It can be used in different regression analysis models, and you also should pay attention to 95% confidence interval. If it is statistically significant, then you can use 2 or 3 as and interpret that association is twice or thrice more likely. Now, you should, I rely on my on advice from Farokh Habibzadeh, who suggested to pay close attention, and if it is arithmetical mean, in between ranges of 95% confidence interval, everything is okay. And if we see too wide 95% confidence interval, there is something wrong. So that's for this part of presentation. Hopefully some of these mistakes will not be repeated and there will be no any reason for retraction based on statistical mistakes. So over to our moderator. Hopefully some of these difficult points on statistical analysis are understood, hopefully by our seasoned authors. Others may need more and more instructions, but we'll play with their data, we'll play with SPSS platform, and we'll discuss with the leading Ukrainian expert Taras Guter, who is also a participant of today's meeting, and we'll try to guide more and more Ukrainian and Eastern European, Kazakhstani journal editors in their statistical analysis.
Yes, I will send to all our participants YouTube link where you can see this recorded webinar many times, yes, and especially this part of webinar because this information is quite difficult. Arman?
Olena, I think you had interruption, or it was me?
No, I think that everything is fine. We have a comment from Yulia Fedorchenko. Thank you very much to Armen Gasparian for his excellent presentation. And I think that we have to move on the final part of our webinar. Our colleagues from Kazakhstan would like to present their researchers.
Okay,
to share
Olena,
their
let me just
experience with us.
explain. Yeah.
Yes,
Let
explain.
me to explain. So first we'll go Dana Bekarisova, please join us. She's going to present basics of an example of information analytical study, which is based on local statistical data generated by their official services, statistical service. So without any further introduction, I'd like to ask PhD candidate Dana Bekarisova from Shymkent, from South Kazakhstan Medical Academy, to quickly present your data. You can share your screen, Dana, please.
Yes.
Okay. Good afternoon, everyone. My presentation is visible?
Yes, Dana, but yes, everything is fine, yes.
Okay, Dana, just quickly comment on graphs, how you generated these graphs, and explain a few things. Okay, 5 minutes, 10 minutes, okay?
Okay. So this slide illustrates the dynamics of change in the incidence rate over the past 10 years. One of the indicators is the level of overall incidence rate in absolute numbers. As can be seen on this slide, over a 10-year period, this level increased by 304,492 cases. Corresponding to 100,000 people, this indicator increased by 1,140.6 cases. Unfortunately, data on primary incidence rate in absolute numbers were not available in the compilation for 2011, but since 2012, the level of primary incidence increased by 122,052 cases over 9 years. Per 100,000 people, this figure increased by 470.5 cases. The next slide. The line graph on this slide clearly shows the increasing levels of overall and primary incidence. From 2011 to 2013, there was a fluctuating change in the level of overall incidence rate, when a slight increase and a decrease followed each other. Starting from 2014 to 2018, the incidence rate increased sharply. After 2019 to 2020, there was a gradual increase. At the same time, primary incidence rate starting from 2012 to 2014 decreased gradually. However, after 2014, the level began to increase significantly until 2018. Further, as can be seen from 2018 to 2020, the level of primary incidence rate increased slightly. Next slide.
Dana, no. Just let me interrupt you. So it's your main slide for your presentation. You see, yes. We are discussing trend, 10-year trend of yes. Musculoskeletal diseases in Kazakhstan, regardless of rural or urban population. So overall, this graph shows us trend, 10-year trend. At the beginning and at the end of this line, we see increase, and it's an impressive, remarkable increase of the number of patients, registered patients with musculoskeletal disease. So does it mean that there are now close to 1 million inhabitants with musculoskeletal diseases in Kazakhstan? Last figure.
Yes.
Is that okay or not?
If you have, I think the incidence rate has increased not only in Kazakhstan, but throughout the world. Therefore, a gradual increase in the incidence seems natural.
Okay.
It's noteworthy that from 2019 to 2020, the incidence of the urban and rural population has decreased. I will show you it on the next slide.
Okay, but I'm concerned with this data. 981,000 and next year 987,000. So is that possible that COVID-19 slightly contributed to that increase? Because I know that registration of patients with musculoskeletal diseases is quite problematic during the pandemic. We need another graph of registered or confirmed cases of COVID-19 to combine these graphs to better interpret your results.
Okay.
Also, 2018, 2019, we see slight decrease of patients with musculoskeletal diseases. However, next year, 2020, we have, again, slight increase. Whether it's because of COVID-19, whether it's because of immobilization or other confounding factors, we need to have a second graph, second line, let's say line of COVID-19 cases. Okay.
I will add.
Yes,
but as you know,
if you have data, you have data.
Okay. As you know, the group of musculoskeletal diseases includes not only rheumatic diseases, but also injuries and other diseases. Perhaps there are more injuries in cities due to injuries, or not only rheumatic diseases or COVID-19. I suppose.
Okay, yeah, good. But in the era of particularly first year restrictions, quarantine measures could be or could also decrease number of traumas, number of orthopedic causes of musculoskeletal disorders. Okay, good. So it was just suggestion to mention about, we are just discussing, and the same discussion may take place at a later stage when you publish or start defending your study. Okay, next slide and continue, please.
Next slide. On this slide, I want to draw attention to the incidence rate of the urban and rural population of Kazakhstan. On the line graph, the incidence rate of the urban population is marked in green, and the incidence rate of the rural population is marked in purple. The line graph illustrates that the incidence rate of both populations has increased over a period of 10 years. For the urban population, the incidence rate has changed from 2006.7 to 2,605.6 cases per 100,000. During the same period of 10 years, the incidence rate of the rural population also increased from 1,146.4 to 1,342.9 cases per 100,000. It can be seen that the incidence of the urban population is almost 2 times higher than the rural population. Next slide.
Again, sorry.
In conclusion,
without conclusion, just wait a second. Just show previous slide. Go back. Okay. So, are you now suggesting that there is any association between urban and rural status and musculoskeletal disorders over the 10-year period?
Yes, I think that this was due to the announcement of lockdown last years, and for this reason, I'm sorry.
It's okay.
For this reason, people were afraid to leave their homes, and the number of patients who visiting doctors decreased last 2 years.
Okay. Well, okay, good. Next slide. And conclusions, your conclusions.
In conclusion, the following trends in incidence were identified. The overall and primary incidence of diseases of the musculoskeletal system in the Republic of Kazakhstan has increased significantly over the past 10 years. The incidence rate of the urban and rural population increased over a period of 10 years. However, as I said, from 2019 to 2020, the incidence in both populations decreased slightly. The urban population suffers from diseases almost 2 times more than the rural population.
Good.
Thank you for your attention.
Dana, thank you very much. Brilliant presentation. So with all helpful animation techniques, tools you use, everything is clear, but still I am not convinced that urban or rural population have differences in musculoskeletal disorders. I would be also would be happier with COVID-19 official data to understand whether there is any connection. At least lines could also, even if we don't have any statistical analysis, we simply draw lines, we may compare these lines, and it's now your task, if you have data, if you can access, retrieve information about COVID-19 cases in 2020 and
okay,
we have just 1 year.
My presentation with new data. Thank you, and in addition, I want to thank two organizers, moderator and the speaker of today's webinar. Thank you for your relevant actual information and useful skills that will be needed in the work of each researcher. Thank you.
Thank you very much, and thank you to all Kazakhstani research fellows attending today's webinar. Burhan, any thoughts, comments? Can we publish this data? I know that you are quite critical reviewer, and I would afraid to invite you to evaluate this research information analytical. But anyway, brief comment just to help Dana Bekarisova without suppressing her initiative, because we need this type of research, even with a lot of data, a lot of information that not readily understandable, population, urban population, and the number 1 million musculoskeletal disorders for a population, total population of 18 million in Kazakhstan, it's quite high. So we know just 1%, 0.1% for some rheumatic diseases, but 1 million is quite high. Any thoughts, Burhan?
Sometimes I decided my reviews are very long. But I know that this process is very important. Peer review process is very important, and
okay. I would like to ask you pay more attention to statistical data presentation next time do you review, to graphs, linear graphs, whether these graphs are correct, illustrative, informative, this type of things based on today's webinar. Okay, thank you. And we also have Akerke, again from South Kazakhstan Medical Academy. Akerke, briefly introduce yourself, your study, your main interest in musculoskeletal diseases, and what's the difference between your presentation and Dana's presentation, without going into details, quickly. I know that you worked separately on the same data.
Okay, I will try. Is my voice audible?
Yeah, everything is fine.
Okay, so I've analyzed the incidence of disease of the musculoskeletal system and connective tissue disease of the population of...
Correct. Slide, pokaz slide.
From the first slide, please. Full screen.
Yeah.
It is not
go to your slide. Directly go to a slides, pokaz slider, and from the first. First, focus.
So, in this slide, we can find the morbidity of the entire population of the Republic of Kazakhstan of all ages, adults, teenagers, children. In this diagram, we can notice the disease of the musculoskeletal system and connective tissue disease, that they are steadily increasing from year to year, especially last 5 years. In 1999, the incidence of disease of the musculoskeletal system was 1,451.5 per 100,000 people. In 2019, this figure was 2,095.5, which is an increase of 69.1%. It should be noted that over the past 5 years, as I said before, we have seen a steady growth trend of the chart. In this slide, general morbidity of the population registered in medical.
Move to next slide. I cannot see any movement. Go to Pokaz slideshow, and then choose from the beginning.
Okay. Okay,
we can see only your second slide. You should move Pokaz slide off.
Pokaz slide off.
And start from beginning.
Is it visible or not?
Visible, yeah, but you should go to Pokaz slider, click on Pokaz slider, and then first slide.
Кирке, вставка, дизайн, переходы, анимация, and next показ слайдов. Next, переходы.
Okay. Is it okay?
Yeah.
You should click 2 times.
Click on.
Click twice. 2 times. С текущего слайда. С текущего слайда.
Yes.
Is it visible now?
No, you
maybe button
you click 2 times. 2 times.
Okay, so Akirke, you used graphs.
Yes.
When you have too many figures, it's quite confusing. So, and Dana's approach to linear graph, I think, is more appropriate, but we have something to compare. It's okay.
Is this slide visible to you now?
Yes. So just comment on this slide.
So there we can find information about general morbidity of the population registered in medical and preventive organizations by ages, adults, teenagers, adolescents, and children. From the right side, we can find the absolute numbers. So as the diagram shows, the vast majority of patients over all years are teenagers between 15 and 17. They are shown in blue here.
Can you tell me, one graph is one figure is different from the rest. I see peak or something. Please focus on that peak.
It is teenagers. Numbers of teenagers in 20 and 2.
Okay.
In all charts in the diagram, we can see that vast majority of patients, they are teenagers here. Then goes adult patients, after that children's respectively. Second place, adult patients, they are shown in green here, and also shown that morbidity among children is much less common than in adults and adolescents. However, it is possible to observe a steady growth trends in all groups, year by year. I've changed my slide. Is it visible to you now?
No, we cannot see any change. So next, move. Okay, now we can see, yeah. So morbidity of entire population. So difficult to interpret. So there is no to discuss. Only briefly, please, Akirke. Yeah, briefly.
Second. They are similar diagrams, actually. In this slide, we can find information about morbidity of urban and rural population of Republic of Kazakhstan. As can be seen in the diagram, patients of the urban population predominate for all years. This may be due to the low level of rural residents seeking medical care, as well as the significant remoteness of large territories from specialized medical institutions. In
Next
all
slide.
years,
Morbidity of all women throughout the COVID. So general morbidity, all types of diseases? Are you discussing
musculoskeletal diseases only?
So your titles should include musculoskeletal, because otherwise I cannot understand. It's morbidity. Okay.
I'm talking about only musculoskeletal disease.
Anyway, so, each graph should be standalone, should include that. Okay.
So as you see here, the overwhelming majority of the patients were women. From the left side, especially last 5 years, the number of women patients, they are increasing.
Female patients, yeah.
Female, yeah. There was a very high dynamics of the increase in morbidity over the analyzed period of both general and primary morbidity, musculoskeletal disease. Okay.
So why women are more prone to musculoskeletal diseases? Because of obesity, because of traumas? Okay, your guess?
Maybe, but I guess some point has a hormonal phone of the woman, of the female patients.
COVID-19, what about COVID-19? Over the past 2 years, any association? No? Based on this data, any guesses? No?
Unfortunately, I have no data about COVID,
next slide.
Especially COVID.
Okay, yeah. You didn't cover 2020, yeah.
Yeah. So to sum up what I said before, I can fix some main points. So the high prevalence of rheumatic disease requires further improvements of specialized care, the use of innovative technologies in the early diagnosis and the treatment of patients. Secondly, early diagnosis of irreversible methods of therapy will affect the reduction of mortality in rheumatic disease from complications. Rheumatic disease, I mean musculoskeletal disease in general. Adequate personalized therapy will help reduce the cost of treating patients with rheumatic disease. And last one, the overwhelming majority of patients are women. And then that's
okay. And the last slide, you have last slide as well.
So, last slide, it is thank you for your attention. Thank you for the opportunity to speak in front of such a distinguished audience.
Yeah, thank you, Akirke. So, you presented something quite, to me, it's quite difficult to understand, but still, we should deal with it. And we should deal with your conclusions. Most of these conclusions, you can have only one conclusion based on this data, but yours are quite, your list is quite expanded, I would say. Anyway, good. Thank you for drawing our attention to the problem. Now we should think why women are more prone to musculoskeletal diseases in Kazakhstan based on official data, and we should find out. So today we also have with us Ainur Kumar. Dr. Izakenova. They are PhD specialists, specialists with PhD, with defended PhD years ago. Yeah, but they also published information analytical studies, and hopefully one day they will share their knowledge and experience with information analytical studies. These studies are based on strong statistical data, because Ministry of Health processes data, and we can trust this data. We can trust mortality data in connection with some diseases, but we cannot generalize data from single centers, let's say on incidence or frequency of some musculoskeletal diseases. Anyway, we should continue working on information from your presentations and try to convert this in articles. Thank you, Dana, and thank you, Akirke. Olena?
Thank you, Dana. Thank you, Akirke. And especially thank you to Dr. Armen Gasparyan for his excellent presentations. It seems that we have discussed all items of today's program. Who would like to add something? Professor Konstantinovich, Professor Lonchina. Arman, we cannot hear you. Please.
I think Svetlana Velikova may also join us from Sofia. She also tried. Dr. Velikova, are you with us?
Hello.
Hello.
Can you hear me?
Yeah, but with interruption.
Yeah, I'm listening carefully, but I'm on a vacation,
I see.
so it will be
any point, commenting point?
To make valuable comments.
Okay, good.
Thank you for the great webinar.
Okay, thank you very much. And I look forward to processing your next great article based on our recommendations. Okay, Olena?
Thank you. We hope that that knowledge gained during today's meeting will transform into advanced academic activities and great articles.
Other comments, questions? I interrupted. Probably someone wanted to have more, to say more.
We have one comment from Professor Jerzy Konstantinovich, a fantastic comprehensive meeting, and comments from other participants, from Margarita Gromova, thank you for the useful information, from Janar Tuminbayeva, thank you.
You cannot hear me probably.
We can hear you properly now.
Oh, that's only visions. Just congratulations. Long, exhausting, but very, very useful.
I see. Yeah.
Congratulations for your. You are very.
Thank you for your patience. Thank you.
This was really useful. This was really helpful for young scientists, and this will they would benefit from it. Thanks, Armen. Thanks
a lot. So we have Professor Konstantinovich, pediatrician. We have Professor Smiyar, pediatrician, and other professors. Professor Pankiv, endocrinologist, and all of them are Professor Vasil Lonchina, bioethics specialist. All of them publish a lot and edit a lot, and try to increase indexability of their journals.
Also, Professor Roman Yatsishin is with us, yes.
Yeah, he is vice president of Rheumatology Society, All Ukrainian Rheumatology Society. Thank you. And I am sure his fellows, Dana, Bohdana Toskaluk, also with us.
Yes.
So thank you for your patience. Hopefully we will see some great reviews, original research studies, online surveys, information analytical studies as a result of a long series of webinars.
We wish to all our participants to publish great articles in ethical indexed journals. Yes.
Okay, thank you.
Have a good evening and see you on the next webinars. Goodbye.
Okay, thank you. Stay healthy. Bye-bye.
Bye-bye.
Goodbye.